When are throat infections most infectious?
It depends on what kind of throat infection it is.
Okay.
So there's different kinds of throat infections. One is caused by a virus, which we've been talking about with colds and things like that. The other kind of throat infection is strep throat, which is also common in kids, and that's caused by bacteria.
Okay.
So that one, strep throat, can be very contagious in the first few days that you have the illness. It's contagious until you've had antibiotics to treat it for at least 24 hours of treatment.
Okay.
For other viruses that cause sore throat, it's kind of like a cold, where we say the first few days, the first 3 or 4 days, it tends to be more contagious, just like a cold would be. And the medical term for sore throat is pharyngitis, which just means inflammation of the throat or the pharynx.
That's a fancy term.
Fancy term, yes.
Okay, so pharyngitis means throat infection. So now you know when your pediatrician diagnoses your child with that, what that means. Just simply throat infection. So you said that there are viral throat infections and then there are bacterial throat infections like strep throat. So when you have a viral throat infection or viral pharyngitis, then...
That's good.
You basically, how is it diagnosed and how can you tell that it's not strep, first of all?
It's diagnosed basically by your symptoms, by your doctor, by your pediatrician, by the symptoms you're having, which is just sore throat typically. And a lot of times you see it with the cold symptoms. So a lot of the viruses that cause colds also cause you to have a sore throat.
Okay.
So you'll see the sore throat and you'll see it with other symptoms too, like runny nose, cough, sneezing, things like that. When you have strep throat, you don't typically see those other symptoms with it.
Okay.
You don't typically see the cough and runny nose, congestion, unless you're unlucky and have both of those things at the same time, which happens sometimes. But usually if you just have strep throat, you typically don't see those other cold symptoms with it.
I see. So it's not necessary that you have a cold when you have strep throat.
No, it's not necessary. People can have them together, and often they do. But if you have just strep throat, then you typically won't have those other symptoms. Strep throat doesn't cause those symptoms. If you have that, then it's because you've got two things going on at once. So usually strep throat causes fever, sore throat tends to be a little bit more severe, headache, sometimes stomach pain, nausea. Nausea sometimes. Sometimes you can have a rash with it too, called scarlatina rash. So those are symptoms you see. It's usually more sudden onset. A lot of times you see a fever. You don't have to have a fever with it, but a lot of times you do see a fever with it. And it's more of a rapid onset than the viral pharyngitis is.
And it's a more severe throat pain.
It usually tends to be more severe.
You feel like your throat is closing in. Right?
It tends to be more severe, although there are some kids where they have milder cases of it and they don't really realize that they have it until we do the test. So the way you talked about diagnosing it, and the way we diagnose it is by two ways. And usually what we typically do is a rapid strep test, which most pediatricians will do in the clinic. And they just swab your throat and they run a little test on it, and it takes about 10 minutes or so to run a test, and it tells you if they've got strep throat.
Okay.
That test is pretty good, but it's not perfect. It's like 70 to 80% accurate. So it does miss some cases of strep throat. The other way we do it, which is the gold standard, is a throat culture, where we swab the throat and then we culture it. We usually send it to a lab to culture it. That's the better test, but the problem with that is it takes time. It takes like 2 or 3 days for the results to come back.
Okay.
So usually what we do is we start off with the quick test in the clinic. If it comes back normal, then we'll do the backup test.
So is there like a clinical diagnosis? Like, for example, in strep throat, do you get any like pustules or anything like that?
Based on those symptoms, you can a lot of times you can kind of get an idea of this may be strep throat and maybe not a viral pharyngitis by the kind of symptoms they have. Sometimes the appearance of it, if you've seen enough of it, like I can a lot of times tell this looks like strep throat. Sometimes you see little red spots on the palate. But pus you can see with either one, so that's not a diagnostic of it. So you can kind of get a general idea if you're an experienced doctor, but it's not reliable either way.
There you go. So the keyword here, so experienced doctor, not experienced mom. Right?
But even for doctors, it's not reliable just to do it visually.
Okay.
So it's not good practice to treat for strep throat without doing a test of some sort, either the rapid or the culture, or oftentimes both.
So is a throat redder when it's when you have strep throat, or it doesn't really?
No, not always. Like I said, they're not reliable. Okay. There's different viral illnesses, and they can have different appearances. Some of the worst throat infections I've seen were not strep throat; they were from viruses.
Okay.
So it's not reliable just by looking at it. Like I said, we can kind of get an idea. We suspect one thing or another, but to really make the diagnosis, you need to do that test, the culture or the rapid strep test.
Okay.
And most of the time, we don't treat, if it comes back normal, we typically don't treat with antibiotics. So if it's a virus, you shouldn't give antibiotics for it, because it won't make any difference at all.
Okay. How long does a viral pharyngitis last?
Same as a cold, usually about a week to 10 days.
Okay. And strep throat?
Strep throat, if it's treated, gets better pretty quickly. Once you start antibiotics, it's better in like 24 to 48 hours usually.
Okay, so it's important to get those antibiotics in. What if you have strep throat and it doesn't get diagnosed and treated? Can it morph into or develop into anything else?
It can. Sometimes a rare complication of strep is you can get abscess, like a tonsillar abscess. We call it peritonsillar abscess if it's untreated. Most of the time, if strep is not treated, a lot of those people will just get better on their own. But what we worry about is something called rheumatic fever, which causes heart problems. And that's the reason why we always treat strep throat.
What about meningitis? Is there a link?
There's not a very strong link. It may be a rare complication of strep throat, but it's not something we commonly see. Okay. The number one thing is rheumatic fever. Yeah, that's the number one thing, the reason why we treat strep throat. So even if they were getting better, we would still treat strep throat. Even if I saw someone like a week later and I suspected they had strep throat, or we did a test and they had it, but they were still better, I would still treat them to prevent rheumatic fever or prevent complications.
Good to know. Good to know. What about foot and mouth disease? Now, that's also some kind of throat infection?
It is. It falls in a category of one of the viral pharyngitis, and it's caused by a virus called Coxsackie virus. And this one is a little bit different in that it causes like sores or ulcers in the back of the throat. So you'll see some sores back there, and then you'll see sores often on their palms and soles of their feet also. So that's why it's called hand, foot, and mouth disease, because it involves those three things: a hand, foot, and a mouth. Okay. So we see this more commonly in like preschool kids. It's common in daycares and schools. So it can be a pretty bad illness, and they can have high fevers with it. And because the ulcers or sores they can get can be very painful, and one of the complications is dehydration, because it's so painful the kids don't want to drink anything.